I'm Larry Menti. Coming up this week on Jersey Matters, the Omnia Health Plan. It goes from being controversial and under attack in Trenton to becoming popular. We'll tell you what happened. Also, conservative columnist from NJ.com, Paul Molshine, is here. He's going to talk about the Trump phenomenon and whether it's going to play in New Jersey. And the gas tax, real popular with politicians, not so much with the public. We have the numbers. It's all next because Jersey Matters. I'm Larry Menti. Welcome to Jersey Matters. Oh, how a story can change in just a short time. Our topic today, to start off the show, is the Omnia Health Plan put out by Horizon Blue Cross Blue Shield. Just a month ago, the headlines were talking about a controversial new plan. Now the headlines say it's a popular plan. What changed? Well, we'll talk about that with my first guest, Mary Ann Christopher from Horizon Blue Cross Blue Shield, New Jersey. She is Chief of Clinical Operations and Transformation. Thanks for being here. I appreciate it. We should talk about what the plan is before we get into the headlines and the possible legislation and the data that's just come out. Exactly what, it's a tiered plan. Explain that.
So Omnia is really the culmination of over 6 years of work at Horizon. Long before ACA was even thought about, Horizon took very seriously its responsibility to not only individual members, but the broader public health. And so began a very focused and intentional journey to value-based transformation in healthcare delivery. And it really is a phenomenal story. I mean, 6 years ago, Horizon launched an effort with the very dedicated nurses and physicians who operate in primary care practices, the part that's so important to keeping people healthy, and engaged in a patient-centered medical home journey that would change the dynamics about primary care so that physicians had the reimbursement and the tools, and the nurses working with them would have the tools to do for people what they needed, to negate that need to really access emergency departments for primary care needs that are better managed in patient-centered medical homes. Now think about it, 6 years ago, there were only 100 physicians in New Jersey practicing in those models. And because of this extraordinary focus that Horizon dedicated with the help of Rutgers University, who did a lot of the work around changing nursing practice in primary care physicians, we now have 6,000 primary care practices functioning in a value-based role. That was the first step in this value-based transformation journey. And another was an Episodes of Care program, which Horizon has sponsored, and we are the largest commercially insured health plan really promoting episodes of care, and we have received many, many national recognitions. And Larry, why this is so exciting, it engages specialists. So I just spoke about the primary care physicians and nurses who support them, but the Episodes of Care program really recognizes the extraordinary effort of specialists, those who we might go to for joint replacements, for pregnancies, for certain oncology diagnoses. And what that does, it creates the opportunity through different reimbursement mechanisms and a different focus on quality and access for patients to be followed across the episode of care so that there are warm handoffs when someone goes from that specialty practice into the hospital and then comes back out. And the reason that's transformational, because then you don't have patients going to emergency departments in that episode or going back in unnecessarily for readmissions. And Omnia represents the next chapter in that.
I get it, and that's the exciting part, and that's the transformational part. But let me all put that through a filter and talk about both the popular part and the controversial part, according to the newspapers. The popular part is that it affords health care to more people that couldn't afford health care before. And that's what you talked about, the ACA, the Affordable Care Act, also called Obamacare, that was supposed to get more people into the system, and this is more affordable. But it is more affordable, and correct me if I'm wrong, because there's two tiers. There's a tier 1 provider that you can go to, and that's where you get the lowest price. But there's a tier 2 provider where the cost would be an extra cost. And it is the people that are involved with the Tier 2 providers, either that is their primary or they are the Tier 2 provider, that have pushed back against the plan and have complained to legislators. And that's why Trenton got involved in the first place. That's all fair, right? That sums up the problem.
Well, I think maybe, let me just clarify a little bit of what you said, Larry, if I might. There are some Tier 2 providers who are opposing the plan, but actually many of the Tier 2 providers are not. And so...
But the problem you're having is with the Tier 2 providers that are pushing back against the plan. That is the main reason Trenton and some legislators are involved, because they are affiliated in some way with those Tier 2 providers, and they're saying, hey, this is going to hurt our bottom line. They don't know if it's going to hurt their bottom line. They're just thinking it is, and they're saying this could potentially hurt us. Is that fair?
Well, they might be saying that. Let me point out, though, that the research across the country, because tiering is not a new notion. You know, tiering has been part of the healthcare delivery system for some time. In fact, Horizon had a tiered product before Omnia, and evidence clearly shows that that is not the case.
Omnia is getting the most attention because you are the largest, and this plan might end up being the largest, especially with your new data. Are you concerned at all about what Trenton might do to your plan?
No, I think the dialogue in Trenton, much as you kind of opened the show saying, you know, first there was, you know, some perhaps negative press, and now the conversation has evolved. This is all about a change and a transition, right, and about a transformation. So we are not concerned. You know, I think clearly folks are beginning to understand what the fundamental principles of Omnia are, and frankly, even beyond Omnia, what Horizon's fundamental commitment to transformation in healthcare is. And so I think as we have the opportunities through programs like this and through our dialogue with the legislature and our thought leaders, policymakers in the state, folks are developing a strong comfort level, and frankly, the majority of people are proponents of Omnia.
Well, we found that out, and that's how the story changed. And so we're saving the best news for you for last, and that is the data that has been released. Talk about the popularity of this plan.
So we're really delighted that we have 250,000 members in Omnia already, and that's really in the early months. And I think what is really the compelling thing that really allows me to get up every day and feel good about what we're doing as a nurse with over 30 years of experience caring for really fragile populations. 41,000 people who didn't have insurance before now have insurance because of the Omnia product. And
that's
to me,
amazing.
that's a victory.
And that's something that legislators can't ignore. And most of the stories that have been written have been saying it was controversial before. However, something this popular can't be ignored by legislators. So you would think that many of those problems then, if they were problems, would go away.
Right, and I think they are going away, because that's a compelling story, not only for each of the individual 41,000 people, but for the broader public health in New Jersey. And when you think about these 41,000, they were often the folks that were working multiple jobs, trying to send kids to school, caring for aging parents, and for them now to have an option that's affordable and also gives them access to quality patient care within a broader transformational agenda that really commits to giving them primary care access that doesn't happen in emergency departments, that allows them to connect with care coordinators who are nurses in physician practices, and rewards those physicians who have so long been forgotten in the healthcare delivery system in terms of appropriate reimbursement. Like, that's a victory all around. And that's the thing that I can, you know, at the end of the day, feel really good. And I actually feel very honored to be able to participate and facilitate.
I appreciate you being here. Thank you so much to talk about that. Mary Ann Christopher, Horizon Blue Cross Blue Shield of New Jersey, Chief of Clinical Operations and Transformation. That's a long title. When we come back, we're going to talk about the presidential primary and presidential candidates visiting New Jersey, because suddenly, even though we're at the back of the line, New Jersey is important this year. When Jersey Matters continues.